Billing and Collections Part 2. Aging accounts. Identify how long an account is overdue. There's a couple of different ways. We've talked about the pegboard system, which is a color-coded strip may be attached to the ledger. Notes or written codes are placed on the ledger card, may be used. Computerized aging. Key appropriate commands into the aging accounts. It can age the accounts by several criteria. How many days it's past due, 30, 60, 90. Generates accounts receivable reports. There's also additional types of reports available with computerized aging. Some collection technique. Correspondence to insurance carriers in 2 or less days. This makes your turnaround time for reimbursement to the office shorter. There's electronic claim processing. Keep up-to-date claims registers or insurance pending reports. Follow-up collection policies is important. Telephone collections. This is an effective method that is more direct than correspondence. Successful calls require tact and diplomacy. Work with patients towards satisfactory solutions. If they can't make the payment until payday, then document that in their chart. Legal rules and ethical guidelines. You want to check the Fair Debt Collection Practice Act. There are rules too as when you can call and how often you can call. Collection letters. Office policies will determine when to send them. The use of an outside collection agency. Used for highly delinquent accounts, usually more than 90 days. Discretion is needed. Seek a collection agency compatible with medical practices. You want to make sure that they still comply with HIPAA guidelines. Follow guidelines of collection agency. Posting of payment collected through the outside agency. When a collection agency is used, the money goes to the collection agency. The collection agency then will reimburse the doctor's office. The collection agency does take a percentage of what is collected. So usually collection agencies are used as a last resort. The use of small claims court. When should you use, and some questions to ask. In certain circumstances, the clinic or office manager may consider bringing a case to small claims court. Typically, small claims court handles cases that involve only limited amounts, and it varies state to state. They usually do not permit representation by an attorney. They're generally efficient and streamline the process. However, preparing for small claims can take time, takes people away from the office as well. Bankruptcy, Chapter 7. A proof of claim form of the patient's account is filed. If a patient has claimed Chapter 7, you need to file that claim. Chapter 13. The patients are allowed to pay the bills over time by court-determined amount. Unsecured medical debts are usually the last to be paid. Estates. There's fee collection goes to the executor of an estate when someone passes away. The guidelines show courtesy. Prepare an itemized statement, mail to the executor of the estate. Address statement to estate of, and then the patient's name. Contact the probate court for additional information. Some other special collection situations. Skips. These are people that leave no forwarding address, get rid of their phone number. So you want to check the address, call the patient, call any numbers that you have. The policy will determine how far you go in tracing skips. Sometimes referring it to a collection agency is a possibility. That way that they can follow up on that for you. Statute of limitations defines a period in which legal action may take place. It's defined by the class that the account falls into. Open book account, written contract, single entry accounts. It's determined by the state's limitations, and it varies from state to state. Maintaining a professional attitude. Collecting past due accounts is difficult and can be discouraging. Quickly identify the accounts that cannot be collected and write them off. Keep any biases and emotions out of the process. It's difficult when you have a patient on the other line who may be crying and upset because they've fallen on hard times. We can all empathize with that. However, rely only on the information from the aged accounts. Strive for a win-win as much as possible.